Well, good afternoon, everyone. This is Paula Hoos. I'm the coordinator for the New York Integrated Food Safety Center of Excellence, the New York CoE. Here with me are co-directors Dr. Madhu Anand and Dr. Andy Newman. We are all going to rotate speaking for certain sections of this presentation. I'm going to start it off. And what we are going to talk about today is about building regional relationships and how we here at the New York CoE have used a regional approach to guide and advance our CoE efforts. So just a bit of background, the New York CoE is a collaboration between the New York State Department of Health and Cornell University. The regional network partner states included in our region are listed below. We're distance-wise, we're a smaller swath than a lot of you. Population-wise, maybe not so much, but Connecticut, Delaware, Maine, Maryland, Massachusetts, New Hampshire, New Jersey, New York, and New York City, Pennsylvania, Rhode Island, and Vermont. So New York earned the CoE status in the fall of 2015. We joined at that time 5 other CoEs already in existence, Colorado, Florida, Minnesota, Oregon, and Tennessee. Our goal from the beginning has been to encourage our regional partner states in forming a food safety learning collaborative in a way to achieve shared food safety goals. We don't believe that any one state, including New York, has a monopoly on best practices or ideas. We really wanted it to be a group sharing and learning and figuring out problems. So to kind of kick off our learning collaborative, we held a call with subject matter experts in Epi, Lab, and Environmental Health from all of our network partner states and jurisdictions in the very beginning of 2016 to kind of let them know that New York and Cornell, formed a CoE, we're a center of excellence, and then how we wanted our approach to be going forward, welcoming them as learning collaborative partners. One of the really great benefits we did after the call was we developed a contact list. I know it sounds simple, but just having a contact list for each state and jurisdiction where I have a primary Epi, EH, and lab, so 3 contacts at each site that I can pretty much email or call at any moment, and they kind of always are in the loop. They know what's going on. And then, of course, we added secondary contacts. So if there were 3 or 4 different Epi backups or a few environmental health or laboratory, they're in as well. But a lot of times when we're, thinking about an idea or want to get a project started, we'll reach out to the primary contacts and kind of get a feel of what's going on or what needs are. So it's been a really great resource to have. And people are really good about updating me if someone's left a position or someone new to add. So it's been a great help. And so, we fully recognize that New York doesn't have all the answers. We really try to find ways to facilitate collective discussions, to solve problems, address needs. And, a lot of times, as we all know, we need to come up with the best solution that's possible at the time, given the resources. And that really works best as a group effort. A one-size-fits-all approach doesn't always work, as we all know. So to determine needs, how we kind of started off our CoE efforts, we wanted to develop a needs assessment to get feedback from our subject matter experts in our region regarding what training they wanted, what outbreak response needs they needed, were lacking. So what happened was that we crafted 3 separate assessments, one for Epi, one for Lab, one for EH. There was a core form on all of the surveys that was consistent. It was the same, and it addressed topics that were really applicable to all food safety workers and foodborne disease investigations. But then within each Epi, Lab, and EH specific surveys, there were questions specifically tailored about different Epi needs or laboratory needs or environmental health needs. And the link on the bottom, when you click on it, these webinars are all recorded and archived you can use these links to see essentially copies of the 3 different surveys that we utilized. So for more information on the needs assessment itself, we did publish back in, it's actually in the current print now of the Journal of Public Health Management and Practice, a manuscript, Foodborne Illness Outbreak Investigation Training Needs, a survey among state public health staff in the Northeast and Mid-Atlantic United States. So you can go on and read the results of the survey. What we specifically used the results of the needs assessment for right off the bat was we held a 2-day food safety symposium at Cornell University in July 2016, where we funded 3 subject matter experts from each regional partner state or jurisdiction, 1 from Epi, 1 from Lab, and 1 from EH, to attend. And we essentially used the results of the needs assessment to shape the agenda. So we had, while there were some standing items we knew we wanted to include going in, we were very objective, and kind of the top 3 needs cited by each specific discipline, were somehow covered. A lot of them overlapped with whole genome sequencing or CIDT, but we were able to kind of hit the different needs, and being in a person-to-person room, able to discuss, it really was effective. And I think, I know the people who came were happy that their survey, their opinion mattered, essentially. We took what they said they needed, and then we discussed those topics. It was multidisciplinary and regional attendance. Overall, we had 27 learning collaborative partners. There were attendees from, obviously, New York State Department of Health and Cornell University. Alice White came from the Colorado CoE to kind of talk about the different products and services at that time. We were still relatively new to the group, so it was very nice to hear the different services being offered. And then we had program directors from CDC come as well. The agenda and the needs assessment results, again, if you're looking for more information, can be found at the link on our website. But it was essentially, it was a 2-day course. We split it up for driving-wise reasons. It was kind of a half a day, and another half a day. And so the symposium consisted of lectures, exercises designed to stimulate group discussion. Discussion was really the big thing we wanted. We didn't want to just, it wasn't the time for a PowerPoint presentation. PowerPoints can be done in a setting such as this, where it's a webinar. If you're all getting together, you really want to have group discussions and not a definite layout, kind of see where it goes as the informations go on and more, needs are addressed or problems are brought up. And again, we had overwhelmingly positive feedback received. The top action items that came out of the symposium, we used the last, probably half of the last day was a half day. We probably used half the half day to come up with, where we wanted to go from here after having discussed things for a day and a half. And the top action items that came out were mainly on whole genome sequencing and training needs for Epi, for laboratory. Assistance with C4 guidelines, and then guidance on CIDT, or culture independent diagnostic testing, guidance on CIDT current practices. And so, this really served as a good basis for us to move forward on projects we wanted to complete. We all had certain projects we needed to complete, but then there's always the room for other trainings, and so these were kind of some of our unique trainings that we'll talk about here. So as far as the C4 guidance, we decided this could best be accomplished by holding a monthly webinar series. We began this in May of 2016, and they were set up on a monthly basis. The topic was distributed as well, so if a person was interested in the topic, they could attend. If they weren't, they did not have to. All are archived and mostly recorded, and so we presented each episode of the series covered a chapter of the guidelines for foodborne disease outbreak and response, the toolkit. The toolkit is used to evaluate preparation and capacity for effective public health action. So They roam from fields of epi or lab or environmental health, and so depending on which the chapter and what the topic was, it was either presented by one of us here in epi, lab, or EH, depending on the topic. Overall, there are about 170 students who viewed the live sessions. I don't have a tabulation for how many have viewed it since the live sessions. And we wanted to bring this up too, just to serve as a reminder that New York CoE can serve as a facilitator to work through the toolkit for other jurisdictions as well. The link on the bottom, again, would bring you to the webinar series kind of information that's on the Cornell website, and then some of the archived webinars. And then what we also were able to do is using grant money, we purchased, so it would have been, what, 33 webcams, and we distributed 3 webcams to each partner state or jurisdiction, one for each epi, environmental health, and lab. So again, this is where my contact list came in handy. I don't just want to send out 3 webcams to who I think are the right people at the right address. They're fairly expensive. So it was a very good way to contact each state. Hey, we purchased these items, we would love to send you one if you feel like you can use it for trainings and live learning sessions, stuff as this, collaborative meetings if we want to have a discussion with each other. And it's usually you can just get a better handle on things if you can see each other as you're talking. So I made sure I was sending it to the right person at the right address. So it really helped to kind of just reach out and contact, stay in touch. And the webcams are currently being utilized for online trainings, live learning sessions, collaborative meetings. So we found that this was helpful to do for our partners, and most were very excited to receive them if they didn't have them already. At this point, I'm going to turn it over to Dr. Madhu Anand, where we're going to talk about whole genome sequencing, certain projects we've worked on. I think later on in this series, there might be a whole session devoted to whole genome sequencing and the activities surrounding it by all the COEs, what we're all doing. So Madhu's going to recap some of them, and you'll probably hear more as the sessions go on. It'll take 1 second as we switch positions.
So, hi everyone. So, Paula just mentioned those webcams, and this is a scenario where having a webcam could come in really useful. We initiated a project called Operation Genome, or GNOME. We all say it a little bit differently here. This was our initial version of a live learning series where we brought together an online whole genome sequencing community learning group among the New York CoE Learning Collaborative partners. It was a series of 6 sessions from September of 2016 to July of 2017. And there were rotating speakers from different states that provided a 30-minute presentation of an enteric disease outbreak investigation where whole genome sequencing was used. This was followed by a 30-minute question and answer period. So we had about 350 participants from over 11 jurisdictions who participated across the 6 sessions. And so really good attendance. We did have some people from outside the region, but it was really minimal. We really tried to keep it to just individuals from within the New York CoE region. We did this as more of an introduction to whole genome sequencing. Our attendees were also from a variety of backgrounds, so both epi, lab, and environmental health. All of these sessions were subsequently posted to the New York CoE website, and there's a link that is on the slide. I know this presentation is being recorded, so you can refer back to it again at a later time if needed. So just to give you a little bit more information about Operation Genome, these sessions were set to be a way of learning and discussion-based. The case studies allowed multiple state participation and engagement. we had multiple states, New York and Connecticut and Massachusetts, each provide a case study on a different investigation that they had been involved with and how whole genome sequencing, how they utilized whole genome sequencing to assist in the investigation. We also had some specific kind of themes for some of the presentations. One was the use and impact of whole genome sequencing on enteric disease investigations, which was much more talking about how whole genome sequencing is used for surveillance. We also had a session that focused on how you use whole genome sequencing as a tool to identify or confirm an outbreak source. And then we had another session that looked at using whole genome sequencing as a tool to subtype pathogen isolates from foods or food processing facilities. So as we moved on, we really, this New York session morphed into a bigger live learning series with Colorado that Colorado and the New York CoE developed with support from Minnesota and Tennessee. This occurred through bidirectional video technology used to create virtual classrooms. And there's an example that's up on the screen. You see, little faces from each of the different sites. And usually they try to cap these at about 16 to 20 individuals, and that's more because of what the limit is as far as how many people fit on one screen without going to a second screen. And basically, you can have more than one person in a room, but they really try to limit it to a certain number of people so that discussion can be more robust and it gets a little bit more difficult once you get too many people on for the discussion piece. So these were set up as 5 one-hour sessions. So this was set up in the Colorado CoE region, and states from the Colorado CoE region participated. And this was in September and October of 2017. There were 17 participants. We do have plans on expanding this to all CoE regions in 2018. Right now, we have been working with Minnesota, Tennessee, and Florida and have those set up. Minnesota is going to be leading their own with some support from the New York CoE for one in February. The Tennessee region will be in March. And then we're actually going to lead Florida's one in May, and we are talking with Oregon and talking about whether we could have one in May in their region as well. And so basically what is discussed during these live learning series are case-based scenarios that are bringing the regions together into smaller groups that make it more comfortable to encourage discussion. And often the states within the region come with their own situations to discuss. And so that just continues to support the regional collaboration within each of the CoE regions. Just to talk a little bit, there's a number of objectives. And again, there's a whole other session that's going to go into this in a little bit more detail. So I won't go into all of these objectives. But these are objectives that Colorado largely came up with. And Colorado did an evaluation of their live learning series. And basically what they found out was that as a result of the training, participants did feel more confident or very confident with each training objective that was set out as a result of this training. Particularly, there was an increase in confidence for interpreting whole genome sequencing MLST and describing the impact on outbreak investigation and how whole genome sequencing could be used proactively. And then I think just one other takeaway that Colorado found out from their live learning series is that you can see that all participants felt satisfied with the course, and more importantly, that they identified actions to apply the course information to their own work. So next off, we're going to transition to Dr. Andy Newman to talk a little bit about culture-independent diagnostic testing and a survey we did.
Good afternoon, and thanks for joining us this afternoon. At the request of one of the members of our Regional Learning Collaborative, we created a survey to better understand local practices on how CIDT positive or culture-independent diagnostic testing positive results are investigated in the New York CoE region. This survey included questions on reporting requirements, when case investigation is initiated, and what criteria are used when making decisions about exclusion and release criteria for people working or attending high-risk settings such as daycare or food handlers and other similar high-risk settings. We included similar questions for several enteric pathogens, including Campylobacter, Salmonella, S-Tech, Vibrio, and Yersinia. We distributed this to the New York CoE Epi partners in September of 2017. We had an 85% response rate, and we summarized the results in a brief presentation, which was done up at the Northeast Epidemiology Conference, which was held in Massachusetts in October. I will show a small sample of our results in the following slides. Among the questions asked was, what were the requirements for confirming CID positive results using culture? You'll see in the third and fourth columns to the right that the majority of jurisdictions require culture confirmation of Salmonella, S-Tech, and Vibrio, with a smaller proportion requiring culture confirmation of Campylobacter and Yersinia positive results. We found many similarities across our region. The majority of the four jurisdictions initiate case investigation at the time of the initial CID positive result when they're received, and that's up in the upper left table. Below that, on the lower left, we also found that this includes an interview to assess whether the case works, attends, or volunteers in a sensitive setting, again, daycare, food handler, healthcare profession, something like that, and questions about the potential sources of exposure. Most states exclude based on CIDT results only, and for the most part, exclusions are not reversed even if culture of that same organism is negative. And that is shown in the table on the right, where you'll see that for most organisms, you'll see that the exclusions are based solely on the CIDT results, but aren't reversed if the reflex to culture is negative. Not surprisingly, we also found some different practices across the region too. For example, we found a variety of criteria being used to release someone from exclusions imposed following a CIDT positive result. In this example, it's kind of a busy table. We see that with Campylobacter, release criteria varied from clinical resolution of illness in some cases, whether that be for immediately for 24 hours or 48 hours. Some jurisdictions require 1 or 2 negative cultures and or 1 or 2 negative CIDT positive results. Some jurisdictions require negative cultures, while others would accept negative CIDT or negative culture results. So it's a little bit all over the map here. So kind of our next step, as I mentioned, we noticed that some practices vary between jurisdictions, even within our own region, and we're, as you might know, a geographically compact region with a lot of people that might live in one state and work in another state, which sometimes makes investigating ill food handlers and such a little bit of a challenge due to different exclusion practices. So for our next steps, we're going to reach out to our Learning Collaborative Epi subject matter experts, and the ones who completed the survey, discuss if and how we should standardize practices regarding how these results are investigated in our region for enteric pathogens. We're also considering collaboration with CDC and other COEs to deploy a similar survey nationwide. And if somebody wants to see our survey, we'd be more than happy to share it with them and also discuss some of the pros and cons of the survey that we ran into when analyzing it. The New York State COE was also awarded funding for one of 3 supplemental projects that were awarded or for which COEs were eligible to apply for during last year's ELC grant cycle. And these 3 supplementing funding projects focused on One Health topics for the 2017 and 2018 grant year. Our award was granted to facilitate discussion between CoE and veterinary school diagnostic labs, APHL, and American Association of Veterinary Laboratory Diagnosticians about current antimicrobial susceptibility testing practices and approaches to share AST data between animal and public health to further our understanding of antimicrobial resistance rather than just working in silos. So Cornell University College of Veterinary Medicine will host a one-day, well, it's spanning over 2 days, but an afternoon and morning session in May of 2018. The invitations were recently sent to a variety of people. Within our region, we have invited representatives from state public health laboratories in all of our regional states. We've also invited veterinary diagnostic labs as well as agricultural agencies. In addition, we have invited representatives from federal agencies such as the FDA, USDA, CDC, and NCBI, our American Association of Veterinary Laboratory Diagnostician regional laboratories, some of the commercial veterinary laboratories, including Zoetis, IDEXX, and Banfield, and then academic experts. And that presentation will be, the meeting will be summarized, and tentatively we'll be presenting that data at the American Veterinary Medical Association annual conference in Colorado in July. So I'm going to pass it back to Paula, and she'll bring us home, I think.
We get to hear Madhu once more as well. So we wanted to also speak to a case study we're working on based on a multi-state salmonella outbreak a few years back. We are working with our OB&E regional partners to pilot the project. We are going to go out to Philadelphia, the OB&E site, in April 2018, where we're going to pilot the format for the case study is in 2 varieties. One is a moderated group exercise format. The other is a webinar format, one that could be either completed at the individual level or probably better as a group exercise. So we're going to pilot with Philadelphia in April, and then New Hampshire is going to come to us to pilot the webinar format in May. And then, of course, we'll make it available for other sites after we work out all the tweaks. If you go on the CoE website, Colorado, Minnesota, they have wonderful case studies up. Currently, some of the highlights of ours, we're going to focus on how we use the multi-partner approach, public health, environmental health, agriculture, industry, the use of shopper card histories, which at the time kind of was a novel idea, not so much these days. It's pretty standard practice, but it goes to show how something novel can become standard if it works really well and isn't too labor intensive. How to use analysis tools using the binomial calculator, and then really our collaboration with industry, which again at the time was a little novel, but just how the industry involved was really very good to work with and definitely helped us to figure out what was going on. We wanted to mention Epi-Ready team trainings. This is a service offered by all the COEs, all the COEs, and this is a free training. And whatever state you're in, you can request it from whichever COE you fall within. It's a 2-day in-person course. We, the COE, come to you, developed by CDC and the National Environmental Health Association. The focus of the course is how to efficiently and effectively respond to a foodborne disease outbreak. And really, the coordination, collaboration among Epi, Lab, and EAH and other public health partners is emphasized throughout. The course is really great and gets really good reviews when the audience who attends is appropriate, and that would be new hires or novices to the field, those who haven't already had 20 years of experience doing Epi, Lab, or EAH. But it's also great for those who need a better understanding of how all the disciplines work together. It's very interesting to see how a lot of times even someone who's been working in environmental health for years doesn't really know the Epi side. We're grateful here, and we work very well with our environmental health. So to hear that sometimes in other states, it's interesting, and so they really benefit from the course. So again, it's offered by all the COEs. Here in New York, we have 6 nationally certified trainers, and we're able to kind of bring on new trainers if we kind of do an in-house train the trainer type of training. To date, New York has conducted 6 Epi-Ready trainings to network partner states. Connecticut, 2 in Massachusetts. It's a very big state, and they're decentralized, so they really needed a couple. I'm sure most states do as well for other regions. New York, Pennsylvania, and New Jersey, which correlates to about 250 environmental and public health professionals trained. We had a pretty high demand for trainings in this coming year, and we have scheduled trainings for Pennsylvania, New Hampshire, and Delaware. We are very excited that we'll once again be hosting a food safety symposium. Like I said, we had one in 2016. We wrote it into the grant to have one in 2018, which is this year. The theme we had suggested was transition of foodborne disease surveillance to whole genome sequencing, building regional strength, and facilitating collaborations between laboratory epidemiology and environmental health. It's going to be held in July at Cornell University. And again, we will include a survey in the registration form. And we really want to have happen what happened last time, where we use their input to prioritize on the topics to be discussed. Again, we have a few topics we know we want to include, but we want to leave some open sections for whatever the survey needs identify. It really makes it a better meeting for all those involved when they've had say in what you're going to talk about. And then it obviously stimulates discussion. We're going to keep the format similar. It's going to be a 2-day format. 1 day is just not long enough, especially for the length of travel for some of the states. 3 days is too long, so we're going to keep it at 2. And really, it's just all about discussion. It's not about PowerPoints. You may have a small PowerPoint to introduce the topic, but what we want to do is talk about what the issue is, and then how we want to proceed going forward. We'll design some group projects, some tabletops, and again, we will rewrite in our grant. So we fund 3 subject matter experts from each partner state or jurisdiction, one being from Epi, one from environmental health, and one from lab to attend. So these are the funded. In 2016, we kept it 3 to each state. At the time, some states had voiced that they wanted additional people to send. We just didn't want any one state overpowering another state based on their level of funding or how much money they had to send additional people. So we kept it at the 3, but we do realize that more than 3 are necessary, especially for certain states, and we all have other lives and other job functions, and you do want backup. So while we're not able to fund more than the 3, which we're going to continue to do, this time around, we're going to invite, allow for additional at-cost attendees. So a couple different, basically we're going to say 2 other staff from state Epi Lab or EH, and then a state ag representative. Unfortunately, they'll have to pay for it. They'll be at cost, but hopefully that'll solve the problem of states wanting to send more people. And we want to listen to what they have to say. If they feel that that's necessary, we want to be able to allow that. We also invite CDC, and then, like I had mentioned, additional staff from each partner state and jurisdiction. And now I think we're going to close it out. We have a few more slides, and Madhu will be speaking to some of our overall regional collaboration points.
So because this whole session was really talking about essentially regional collaboration, we wanted to take just a few minutes to speak about how any state could address working with or within a region in anticipation of the ELC application coming out shortly. Regional collaboration can take a number of different formats, and regardless if you are an OB&E site or a COE site, any state can propose to work together, either with a COE or with each other within that region. If you do plan on doing that, you should make sure that both states or sites are alerted ahead of time, that you both agree on a project, and that you both of you mention the project or activity in your ELC work plan and budget. This really also will help, especially if you're looking to work with a COE site. It helps the COE to prioritize projects, and you can also hash out who's budgeting for which items. So if you do need something budgeted for, it's not falling through the cracks. So an example of that is, I know New York is an OB&E site, and we are working with Colorado on one of our Colorado COE on one of our projects. And so we budgeted for our in-state items in the OB&E budget, but Colorado COE budgeted to fly out to help us out in their budget. So you would just appropriately budget. In addition, in New York, we've provided technical support and training and outbreak assistance through a number of different areas. On this slide, at the end of this slide and on the next slide, I'll go into a couple, but just some topic areas that we've already mentioned are our Epi-Ready trainings, whole genome sequencing trainings, environmental sampling, interviewing assistance, utilizing the C4 toolkit, helping with metric calculation, both on the OB&E side and on the C4 side, and just a variety of other investigation tools. And some specific examples of technical assistance we've provided, and I will actually go through these, is we're continually coordinating learning about other states' experiences with different platforms, and specifically REDCap and Epi-Info. So as we might want to be going out and getting more information on one of those systems, we might reach out to other states within our region that have implemented these systems to see how they've been using it and seeing if they can serve as examples for others, or if we're going outside of our region to learn about these systems, we might welcome other states within our region sitting in with us. We've also provided details on stool specimen kit contacts to at least one other state in our region, so that they can have a ready-to-go kit when they're working on outbreaks. We've also shared a portfolio of the National Environmental Assessment Reporting System, or NEARS, resources and tools that we've assembled along with the New York City Department of Health and the Minnesota Department of Health. We've assisted state laboratories requesting a procedure utilized for Salmonella serotype determination by PFG analysis, as well as assisting a state laboratory regarding the use of multi-top mass spec for identification of enteric pathogens for both clinical and food specimens. That includes testing workflows, analysis algorithms, and reporting. And then, this also seems kind of basic, listing our resources and webinars and having them available on our New York COE website. But we have found that that has been a place that we can refer individuals that are looking for some trainings or tools that we've already developed, and that it's been getting some good response. So, I've mentioned, these as specific ones. There are definitely others, but just an example of how all the different regional partners make up the region. It's not just one of us leading the charge. And so that being said, we're actually wrapped up, and we'll open it up to questions for us. Oh, I'm not sure if there's any questions. Tamara, are you on?
Yes, I'm here still. I'm sorry. Trying to remind everyone they need to make sure they're off of mute, both on your telephone and on the computer, if you want to ask a question. Or you can feel free to type it into the chat box.
Okay. Tamara, I'm not sure if I'm just not seeing anything being typewritten into a chat box. I'm not sure if you can see anything.
I don't see anything either. But we'll give everyone just another, actually I found the chat box is still empty, but if anybody has questions, please feel free to either type them in or ask. We'll stay on the line for another minute. And then if you have questions, certainly you can get a hold of anyone from your regional COE or contact the New York COE directly with follow-up questions. All right, well, I think we can probably go ahead and wrap up since we've not had any questions to date. Thank you to the New York COE for presenting. That was very comprehensive, a really good overview of how you work with the others in your region. So again, if you have questions, please feel free to contact the New York COE directly or your regional COE. And we look forward to talking with everyone again on our next webinar. We'll be hosting one, I believe, I don't have the date in front of me, or we're still trying to finalize it, but we'll be talking about whole genome sequencing resources available through the COEs, and that talk should be taking place in the middle of March approximately. So thank you very much.